All right, everybody, thank you so much for waiting patiently. Today we have Dr. Denise Millstine, and she's an integrative medicine and women's health internist at Mayo Clinic. She's based in Phoenix, Arizona, and is a twin boy hockey mom. Her interests include community education, preventive medicine, and more. She is an avid reader and has won a number of awards over the years, such as the Clinical Educator Award and Dr. Lee Parker Davis Humanitarian Award. Please give it up for Dr. Millstine.
Good morning, everyone. I am not seeing the camera changing, so I'm sure Ronnie is on that. I'm going to apologize for some technical difficulties. There were some firewalls with my organization that prevented me from jumping right into the presentation. So as you've just heard, I am Dr. Denise Millstine. I'm a consultant in women's health internal medicine, the director of integrative medicine at the Mayo Clinic in Arizona, and I'm excited to talk to you about the various pathways that you can take and inspire you to think very openly about where your health career will take you. If you can take us to the next slide, Ronnie. So let's start with consideration. Think really quickly for the next, let's say 30 seconds about the medical specialties that you can list. And then we're going to ask you in a poll how many you were able to think of. So just count them on your fingers or hatch marks. We'll give you about 30 seconds for that. So then let's go ahead and open the poll. How many were you able to think of? So I'm seeing the majority of the answers coming in that kind of 6 to 20 range. We'll go ahead and end the poll. And the next slide. Oh, I have to close the poll on my screen, sorry. So according to the AAMC, the American Association of Medical Colleges, there are at least 160 medical specialties. So if you were one of the people who was in that 6 to 10, let me talk about how we can expand that. Go ahead to the next slide. And my other comment is that there are lots of ways to get to these places. So many of us think about going to college and studying biology, then going to medical school, and then going into medicine or surgery, and then perhaps going into a subspecialty of one of those divisions of medicine. But it doesn't have to be that straightforward and simple. Next slide. So we'll start with where I am now. I've already told you that I work at Mayo Clinic. I work at the Arizona campus. I'm an assistant professor of medicine. I am a consultant in women's health. And then my leadership is in directing integrative medicine. And I also am a leader in the medical school for the Student Community Clinic, which is a charity-based clinic out of St. Vincent de Paul. But I got my start at the Catholic University of America. So this is where I did my undergraduate degree. And I believe most of you are currently in an undergraduate and sorry, my chat is popping up. Most of you are in your undergraduate years or maybe just right after that. I studied biomedical engineering because I wasn't sure I was going to go to medical school, and I was looking for a degree that would open some career paths to me that I could go right into after I completed my undergraduate. And then I went to Loyola University Stritch School of Medicine, which is in Chicago. That is where I got my medical degree. I was a student who went straight through from undergraduate right to medical school. And after medical school, I applied for internal medicine residencies. I grew up in Massachusetts and wanted to land back at home. So I went to the University of Massachusetts, which is in the center of Massachusetts, Worcester, and I studied internal medicine there. As probably many of you know, when you do your residency in many programs, it's an honor to add an additional year and be a chief resident, where you act as kind of a junior staff member and are doing some administrative work and also doing a lot of education. So I stayed for that 4th year. And then I started to work. And then I eventually did a fellowship in integrative medicine that we'll talk about. Next slide. So after that chief residency year, I had experienced continuity clinic in my residency, which means for a half a day a week, several times per month, you would go and see your own patients. You developed your panel of patients, you got to see them longitudinally, and I liked this. What appeals to me about medicine is not procedures, but it's really more the cognitive puzzle and also relationship building and inspiring people to be as healthy as they can be. So I took a job in a community practice that did primary care. I worked really hard. As with anything that is new, there was a steep uphill climb on learning how to practice and how to practice best in an efficient manner so that it doesn't take over your life entirely. So I was married to a physician as well. My husband is a radiologist here in Scottsdale. At the time, he was in a training program in Boston, and he opted, next slide, he interviewed all over the country to see where we might land and fell absolutely in love with a position in Scottsdale, Arizona. I was on the plane to the interview and looking in the back of the American Airlines, or it's probably US Air at the time, magazine to see where is Scottsdale, Arizona. I mentioned that I'd wanted to land near my family, but that just wasn't going to be in the cards. So I reworked my career again. Next slide. As we were moving 3,000 miles away from my family, I discovered I was pregnant with twin boys. So I had my children. I took about 6 months off from work, and then I joined an academic primary care practice. This was a community-based practice, so it wasn't attached at the time to a medical school, but it did have a residency program, and I got to dig deep into what it meant to be an educator. So a lot like what I did in my chief residency, but at this time now I'm building more of a panel of patients. Next slide. As I am practicing in this community, I'm seeing patients. So a young woman will come in to see me and she'll say she's tired. I've got this. I check her thyroid. I check to see if she has anemia. I do a scale to see if she's depressed. Nope, none of those things. So I call her with the results and I say, great news, your thyroid's fine and you're not anemic. She says, well, but why am I still tired? This is not one patient. This is many, many, many patients. And I realized that I'm out of tools. Next slide. Enter integrative medicine. So integrative medicine, I will define for you on the next slide, but this is the Mayo Clinic. Many of you are probably familiar with the Mayo Clinic 3 shields, which represents clinical practice, research, and education. This is the Mayo Clinic insignia for integrative medicine, changed into the more natural 3 leaves, still clinical practice, research, and education, but now expanding to incorporate a number of different modalities that I barely, if at all, learned about during my internal medicine residency and my time in medical school. Next slide. So integrative medicine used to be called complementary and alternative medicine. We try to avoid that terminology at this point. And the reason is that it is so much more than that. So there's a consortium of academic health centers for integrative medicine. All of your major health centers across the United States, many in Canada, some in Mexico, also participate in this North American consortium. And this is how they define integrative medicine. So it's the practice of medicine that reaffirms the importance of the relationship between practitioner and patient It focuses on the whole person. So we get away from that isolated subspecialty care into holistic medicine. It's informed by evidence. So not as strongly stated in terms of evidence-based medicine that you've probably all heard about, and then makes use of all appropriate therapeutic approaches, healthcare professionals, and disciplines to achieve optimal health and healing. This was a real switch for me. I was taught in medical school and taught in residency to think in a disease-based paradigm. What is the problem list of this patient in front of me? What are the therapeutics that I can think of to treat their disease? And in this approach, we're now shifting to think about, how do I make this person as healthy as they can possibly be? Next slide. So some people will think, well, this is pretty marginal. This is that alternative medicine that I hear so much about. Nope. It is actually part of the National Institutes of Health. So the National Institute of Health has the NCCIH, which is the National Center for Complementary and Integrative Health. This used to be called NCAM, but they've changed their terminology, like I've mentioned before. And they break down their therapeutics into these modalities. So you have body-based therapies that would be things like osteopathic manipulation and massage therapy. Mind-body medicine. So this concept that the mind and the body are separate is really ancient and should be revisited as often as possible. So utilizing the mind, harnessing the power of the mind to control things like wellness and also help to mitigate symptoms, for example. So things that fall in there would be relaxation, meditation, and mindful movement like yoga. There's also alternative medical systems. So many of us are very US centric, but there have been thousands of years of experience of other types of medicines like traditional Chinese medicine, also Ayurvedic medicine, and then other approaches as well, like naturopathy and homeopathy, and those are incorporated into integrative medicine. Energy therapies would be things like acupuncture. Qigong is a breathing and movement practice that's part of traditional Chinese medicine, and Reiki comes from a Japanese traditional approach. And then biologically based therapies, which would be things like supplements and botanicals. Next slide. So I'll challenge you to think about what is health. So this was in the British Medical Journal 10 years plus ago, thinking about, do we define health as the absence of disease? And if you think about people that you know, or maybe you've had some clinical experience, I can assure you that you have seen people in your lives that have a low burden of disease, meaning they don't have a high list of diagnoses, and yet they are very unhealthy. Maybe they don't move, maybe they're incredibly stressed, maybe they don't eat well. And you've probably also had the experience maybe of seeing somebody who has a lot of disease, maybe somebody with an advanced cancer who's living their life, who is in a way thriving, getting to do the things that are most important to them. Next slide. So I have really reframed my practice to think about health to being not the absence of disease, but really about resilience, the ability to adapt and to self-manage in the faces of social, physical, and emotional challenges. Next slide. So I'm lucky enough to get to practice integrative medicine in a large, well-respected medical center, which is the Mayo Clinic. Actually, Ronnie, if you can go 2 slides, that would be great. So I see patients for integrative medicine consults. What that means is that they sit with me for actually a very long period of time compared to the time that my colleagues get to spend with patients. And the first question I ask them is, tell me your story. It's pretty incredible, actually, for people to not have to just say, tell me about your abdominal pain, and have to limit what they're telling to their physician that's isolated to that. I'll tell you a story really quickly about a patient who came in with abdominal pain. So she'd had a hysterectomy and woke up in the recovery room. So that's the space that you go to after you've had an operation. And she had intractable abdominal pain. This was several years prior, and she had never been able to get answers to why she'd had that pain. She had CT scans, she had endoscopy, she was tried on a number of different medications. Finally, she sat with me and I said, did you want to have the hysterectomy? And she started to cry and she said, no, I wasn't sure that I was ready to give up the opportunity to have children. This is important, right? The story is important, and we spend a lot of time, energy, and resources in medicine if we don't listen to our patients. Next slide. So beyond talking about their story, we talk about some very critical components to health, such as diet. You don't learn a lot about nutrition typically in medical school, though thankfully that's changing. Next slide. And the reason that this is important is if you look at population data, so this is information that comes from the CDC, that only 12% of US adults meet their daily requirement or recommendation for fruit intake. So fruit intake is going to include your tomato intake, and then you see only 9% of daily vegetable intake. Only 9% of the population reaches their recommendation for daily vegetable intake, and that's going to include potatoes. So I'm mentioning tomatoes and potatoes because these numbers would be even abysmally lower if we took out pizza sauce and French fries with ketchup. Next slide. Here's another representation of the same data. So the number of US adults who eat fruit once a day is in Arizona only about 35% of people. Next slide. In integrative medicine, we also talk about supplements. So many of you from Arizona or the Southwest will recognize this store. There are about 800,000 supplement products on the market. Most physicians are not really taught about how to navigate the world of supplements. Many will tell you that the supplement industry is unregulated. That is not true. It is ineffectively regulated, but there are regulations, and those regulations are really focused on safety. Ronnie, go forward 2 slides for me. So my practice in integrative medicine at Mayo Clinic includes a team. I can't know how to do all these modalities that I've mentioned to you. So I have massage therapists, I have acupuncturists on my team, and then we build a team of experts who can also do classes with us focused on relaxation and meditation, also resilience training with stress management, and then mindful movement. So this is my story. This is where I sit right now. I am an internist who does primary care. I focus in women's health, and then I've built my career around an expertise on integrative medicine. But let me ask you one more poll, if you can go to the next one. So I'm going to give you a list of options, and I want you to just reply with what your first thought is. Go ahead and open the poll. What's your favorite thing to do? So you're only allowed to pick one. Feel free to interpret the options broadly: playing sports, watching sports, spending time with your family, doing your homework. So I could not have predicted that this would be how this would fall out. Only one of you, I was 0 until just a second ago. Only one of you says their favorite thing is doing your homework, right? And then there's a broad distribution. The highest percentage are those of you who like to be social with your friends and your family, which is great. So important to be connected and in community. And then some sports, reading and writing, being in nature, traveling as well. So thanks for participating in that poll. Oh, I'm sorry, I didn't realize you guys couldn't see the results till I did that. All right. So if I were to answer that, I would go to the next slide, or I think it's 2 slides actually. So what I love to do is I love to read. I love books. Of course, in college and medical school, I didn't have enough time to read books. Raising twin boys, it's been hard to find time to read books, but I have been able to overlap my professional pursuits in this way. Next slide. So for many years, I've been able to contribute to scientific writing. Of course, I have academic publications in your typical journals, but one of the things I love to do the most is to put high quality information out to the public. So I've been allowed to contribute to the Mayo Clinic books, including the one on integrative medicine. I participate regularly in editing content for the Mayo Clinic Health Letter, which is a subscription that all of your parents and grandparents, I'm sure, would like to receive as a present from you for your next holiday. That was a joke, of course. The North American Menopause Society, so pulling in my women's health expertise, I contributed into their clinical guidelines. And then I did also write a chapter for Dr. Weil's latest book, Mind Over Meds. Dr. Andrew Weil is the probably grandfather of integrative medicine and really famous in the circles that I run in. His books are typically bestsellers. So this was just part of what I was doing, but it wasn't really the focus of my practice. And one thing that you'll find as you go on this pathway of developing your career is that it's very easy to get on a path and not to stop and think, where do I want to go next? Next slide. So I'd always been a writer. It's always been something that I've enjoyed doing in a variety of different paradigms. But about 3 years ago, I opted to go back to school. So I went to Harvard to study writing for the public. So it was a course that was a year long where I got to develop my writing skills and really work on taking what I say in the office every day, very inefficiently, one patient at a time, and start to put it out into the public space. Next slide. So thankfully, with my work with Mayo Clinic and Mayo Clinic Press, I was able to start a blog on women's health. So we have contributing writers from all across the enterprise, as well as from outside writers. We put out what I'll call high quality health information with a more casual voice. One of the reasons I do this is, like I said, efficiency of communicating messages, but also not everybody can come to the Mayo Clinic. Maybe it's not in your geographic location. Maybe you don't have the resources or the insurance coverage to come to Mayo Clinic as a patient. And I don't think that this information should only be for those who are privileged enough to come and get care from us. And so we have created this blog to put the information out in the world. Some of our most popular blog posts, even though it's not a blog that's you're gonna see on some of your typical social media platforms, although it is there to some extent, but we'll easily see 10,000 hits on the posts, which is pretty exciting for me. Next slide. And my latest project, something that is just about to be released publicly, is a podcast. The podcast is called Read, Talk, Grow. So I mentioned my favorite thing to do is to read books. So I read books, I talk to my patients about them, and now I'm able to talk to authors and healthcare professionals about how we can use books to start to build understanding around health conditions. So as you're in this part of your career, you're thinking about, how do I learn about heart disease? How do I learn about what is heart disease? What's the best way to treat it? What are the ways that it presents? But in this work, it's about, what is it like to be somebody who's had a major heart attack or had heart failure, has heart failure? How do you understand that experience if you haven't lived through it yourself? And I think story through reading is a really, really powerful way to do that. Next slide. So in conclusion, what I want to offer to you all is that you can only choose what you know. So if you only know that there are 5 to 20 medical specialties, I'd encourage you to stay open-minded and to have broad experiences. And also that it's never too late to redirect. So even if you go into a medical school and then residency, you can continuously reinvent yourself in order to really match what you love to do with what you're doing professionally. And then finally, see what your own passions are. Pay attention. If you feel most alive when you're outside, don't become a radiologist like my husband, who has to sit in a dark room all day long and not talk to other people. If you're one of those social people, that would be the same recommendation. If you're going to do radiology, do that in a way that allows you to talk to other people, because it's a long road. So you want to choose very, very carefully. So I just want to apologize again for the technical difficulties that I had at the beginning of our presentation, and we'll open it up to questions at this point.
Thank you so much, Dr. Millstine, for the presentation, for the advice, and also the book recommendations. So if any of you caught that, you could definitely type that in the chat for those who weren't able to get it. But we'll go ahead with the Q&A section. We only have 10 minutes for it, but we do have quite a number. So Dr. Millstine, if you could hover over the Q&A tab so you could read it along with me. So one of the questions is, what were the challenges that you have faced during your starting time of practicing integrative medicine?
Yeah, so the fear with integrative medicine is that it is alternative medicine, and that is really its one major downside, right? So just to focus on the cancer practice for a moment, let's say you see a woman who has breast cancer that is curable in conventional medicine, and she opts to take a unconventional approach and then dies from her breast cancer unnecessarily. So there's a good reason for people to have some fear around what patients are choosing, especially if they're choosing away from effective therapies. And so some of the challenges I faced were in convincing my colleagues that I wasn't trying to draw the patients away. I showed you that image of the tree. So when I talked about health, there was a slide with an image of a tree. That image actually comes or is inspired by the comments of a woman, Dr. Gladys McGarry, who talks about people as being a tree with this intricate root system. If you have a disease, it's like a boulder in that root system, and the whole medical community is focused on the boulder. Do we cut it out? Do we blast it? Do we poison it? How do we get rid of this boulder? But you're the tree. And so integrative medicine is about keeping the tree healthy so you can withstand that treatment or recover from it. And so, so when you have ways to explain to your colleagues that I'm not trying to step on your toes, I'm trying to support what you are doing because I believe in the health of your patient. And remember, integrative medicine incorporates all available strategies, which includes conventional medicine. I can see the questions, if Ronnie, if you want me to just go ahead and dive into the answers. So somebody is asking about if it's similar to DO schools versus MD schools. So DO schools are traditionally much more holistic. Allopathic schools don't tend to. I actually chose Loyola University, first of all, because they let me in, and second of all, because they had a holistic approach in an allopathic school. So I think you'll find that division is not as sharp as it once was. And that, of course, in the osteopathic fields, you're going to learn, in the osteopathic fields, you're going to learn things like manipulation, which you wouldn't be taught in the allopathic school. So I see a question about courses to help on my career. Yeah, so I would read widely. I mean, I would look, you all are functioning in a world where there's so much more information than there ever was for me. So things like Coursera or TED Talks, or, even lectures that are available from medical centers. So there is a academic consortium for integrative medicine that I mentioned. They have an annual meeting. It is usually very inexpensive for students to attend it. Now, it might be costly because it's not occurring geographically close to you, but post-COVID, one of the gifts of COVID is that we often have a virtual offering as well. There's another association for integrative medicine, which I would say is a little bit broader in terms of incorporating other fields. So people like dietitians and chiropractors are a bit more active in that. And that is so of course, AI, sorry, I should have prepared that beforehand. And then I studied at the University of Arizona. So University of Arizona, Andrew Weil Center for Integrative Medicine. You can purchase those courses course by course. Again, I'm not trying to sell you on that. And they often will have sales, and they often will have freely available. Like, so for example, they had a COVID set. It might be above what you're learning, but I can promise you'll glean something from it. So that's another option, is to follow them. Okay, occupational options to pursue integrative medicine in women's health. So you can study integrative medicine from anywhere. I had a pharmacologist in my fellowship crew. There have been radiologists who've gone through it. There's gastroenterologists, neurologists. So you don't have to be an internist to go through integrative medicine training. And then the question is, how does it apply to your field, right? So maybe if you're a neurologist who focuses on headache, then integrative medicine is a really lovely complement to remember those tools that you have when you finish your conventional training. I am laughing at the comment that I did a lot. Do I feel tired? So yeah, sure. I mean, it's really important to do self-care. And that's why it's really important to ask yourself that question. If I love sports and I think I don't have time for sports, that's wrong. Find a way to incorporate sports in what you love to do. Find a way to read if you like to read. Get out in nature, even if that wasn't your top choice. The healing powers of nature, incredibly powerful. I'm sitting next to a window, which is my backyard, and I get visited by lizards and hummingbirds. That is important to my overall well-being, and I'd encourage you to think about that. I'm passionate about women's health because women have been underrepresented in clinical trials and clinical practice for a long time, much like many other components of the population, including people of color. They have been just assumed to be close enough versions to white males, or in women's case, often a smaller version. And that we know, of course, that is not the case. And so I think that there is a need to give voice to populations that have not been granted a voice previously. And so I am a woman, and I think that women's health is important, but that's what's important to me. Something different. You might be somebody who is really dedicated to children, for example. Children don't have their own voice. They operate in their parents' voice, and they may be lucky enough to have educated, health literate parents, but the vast majority of them are not. So if that's what you love, then seek that out. Some turning points in my life that shaped my work in integrative medicine. So I mentioned that I was just on that quick path, right? College to medical school to residency to chief residency to my first job. It took me years to realize, oh, this is not enough. This is not something that's going to sustain me through a 30 to 40 year career. So I need to make some changes here so that I am doing something that I can be passionate about. So somebody has asked for some book recommendations. I'll tell you that the book, I just interviewed the author of The Change on the podcast this week. The Change is a thriller written by Kirsten Miller, who's been a YA author for many years. She has the Kiki Strike series, if any of you know that. But she wrote this book about menopausal women who get superpowers as they go through the transition, and they uncover that some girls had been disappearing, and they figure that out with their superpowers. So historically, middle-aged women become invisible. You don't see them as protagonists in books or as the lead character in many movies. We focus on youth in our culture. And so somebody like Kirsten Miller is trying to change the narrative around women's issues in a way that is truly accessible. So that's The Change. There are a number of books that I would say are inspiring about starting a career in medicine. So the classic is The House of God. This book is now 30 or 40 years old. It was written in the 70s. It is still a worthwhile read. And then he wrote a subsequent book to that that is also really quite an excellent commentary on how we have moved away from caring about people and have been caring mostly about charts and data, and the electronic medical record keeps us focused in that. So books and podcasts that I would recommend. So absolutely, when Read Talk Grow goes public, I'm expecting all of you to sign up as subscribers. There are so many great podcasts. Mayo Clinic has the Mayo Clinic Talks and the Mayo Clinic Q&A podcasts, which are quite excellent and quite short. So they're nice exposures to health topics, because remember what we said, you don't know what you want to do until you know what's out there. So even if you think you're not interested in bladder cancer, maybe take a 10-minute listen to the urologist talking about that and give it a little bit of thought. All of the major journals also have podcasts. So I'm an internist, the Annals of Internal Medicine, the New England Journal of Medicine. You're going to see they have podcasts as well. That might be a bit much for you. It might be a bit too in the weeds. I would stay broad, and I would learn about what it's like to practice medicine. There's also a fairly new book called Letters to a Young Female Physician. You could all read it, but particularly the audience members who identify as female might want to consider that. Did my biomedical engineering degree benefit me? Nope. I mean, I guess it did, right? Because studying engineering, you think about processes. You don't really memorize and spit back out. You have to learn how processes work, and then you apply them in different ways. So I never did anything with it. It was a hard way to do undergrad without then going on to utilize it. But maybe it's part of what helped me to think outside of the box. I was really good at math, and I enjoyed it. So for me, that was a good first set of courses, because again, it fit what I liked to do and was good at. I would have been happy, I'm sure, as a biology major or as a chemistry major, but this was a better fit for me. My husband, I mentioned, is also a physician. He was a classics major in undergraduate, so he studied ancient Greek. You don't have to do the typical path to be a successful physician. It says on my screen that there are no further open questions. I really want to express my gratitude to the organizers of the conference for being open to a bit of an unusual pathway and inviting me to speak. I've had a chance to look at your agenda. I am jealous of all of you that 30 years ago they didn't have such innovations or such a desire to really put this information out in the world. You all are really so lucky to have organizers like Ronnie and Alexia and the rest of the team that have put this together. I am on Twitter. I'm on LinkedIn. If you need to contact me, you can ask Alexia for my direct email. I really appreciate all of the floating accolades coming across my face here on the screen. What a fantastic bunch. And thank you, Ronnie, for driving the slides and making the technology work.
No problem, Dr. Millstine. We really appreciate your talk for today and all the advice that you've given us, as well as the recommendations, really. I hope that people are actually taking note of those, because I think those are really good recommendations. Now, Dr. Millstine, again, thank you for your time. And everybody else, get ready for our next session. It's choosing between a surgical and non-surgical career, a panel discussion. Take care, everyone.